Okay, now moving on to the last question, which also has 4 parts. So parents, I really thank you so much from the bottom of my heart for all your good questions, because, again, I'm asking it on your behalf. So, and it's great that Stacey has. Yeah, these are really good, and it makes you think, right? And it starts dialogues. So, this is here. Do we need to consider financial questions such as the following? So, the first one will be: will this therapy be covered by insurance? And if not, are there available grants or government resources to help pay for it?
So this one, I'm not Malaysian, sorry. So if you're in the UK, then it would be covered by the NHS. We have a wonderful system. However, here, I work with a combination of expat children and local children. From what I know, so certainly the expat children that I work with, a lot of the speech and language therapy, as long as there's a diagnosis then, or a syndrome or something like that, not particularly focused on ASD, then it is covered by insurance. I do work with some children who, it's definitely covered by insurance. But I recommend kind of just check your insurance policy. Here, like with the local people, I'm not sure, you may need to do that OKU card. So you may have to go through that system, and if you have the OKU, then some of it might well be covered. Certainly, like with government, I know you can go the government route, and then that's essentially free. But like I said, there's long wait times. Private, you would really need to check. Check.
Yeah, thank you. So essentially, again, the key message would be you need to check with your insurance provider on whether or not it's covered under maybe the medical card or some other health plan that you have. So the key idea is being aware first, and then checking your resources to see if that covers it as well.
Yeah.
Lovely. Question 3B, how much does this therapy cost per session? I think we've discussed this, right? Yeah. So I think to answer this question,
around like 150 to 300.
150 to 300 ringgit, right?
Yeah.
Okay, so it's not US dollars. Don't have to freak out.
Not USD, it's ringgit. Usually the price depends on a few places would change the price. It depends on the how long the therapist has been working, like how much experience. So, for example, I'm a principal therapist, so I might be slightly more expensive, sorry.
She's whispering. So, she's a principal therapist, slightly more expensive. But we all know, right? Like
sorry.
You pay what you get, right? So, like, for example, even like in the medical sphere, if I want to see a general practitioner like a GP, I'll be paying maybe 80 ringgit, for a consultation session, right? And then, excluding meds. But if I'm seeing a specialist, the amounts can go up to, the hundreds if not the thousands. So it's all about, again, the experience of the practitioner, because that's key here, right? The goal is we want results. We want our child to be comfortable, in the presence of this therapist. So the experience counts, the qualifications counts as well. Yes. Which actually leads to the next question. Actually, would be like, what sort of qualification do I, as a parent, need to look for if I'm looking for a therapist? Like, what must he or she have? Is there like a degree that I should be looking for?
100%. So I do know this is what kind of reverts back to me talking about the lack of regulation. I do know people who are calling themselves speech and language therapists who don't have a speech and language therapy degree. So always check the credentials. They should have if you're seeing a speech and language therapist, somebody who's calling themselves a speech and language therapist, they should at the very least have a bachelor's degree in speech and language therapy. And if not, then if they have more than that, that's brilliant. But then you can also have a master's degree. But just definitely, you feel free, you can ask us. Like, I have no qualms. If anybody comes and if they want to say to me, what are your credentials? I will gladly show you my degree certificates, and all my further training, gladly. And you're entitled to ask, absolutely.
Correct. So again, it's about knowing the right questions to ask, right? Because anybody can claim, to be a specialist, but then not have the backing to support that, and usually, and it's sad to say this because when parents are desperate, people take advantage of that desperation, right? And then it becomes a price war. It's like, if you go to center A, you pay this, you come to me, I charge half the price. But then again, maybe this person doesn't have the training, the professional training at least to do that, right? And it might even cause an adverse reaction, right, onto the child, because if you're not doing it right, you're using the wrong approach. The child might even regress and might not want to work with any other therapist in the future moving forward. and that would be bad.
I've had situations like that where they have gone to a therapist and they've had really, really, really bad experiences. So it's taken me like a month or so of the child coming in screaming, crying, just not wanting to do anything with me because they've had such a terrible experience beforehand. And so it's taken me, quite a long time to build up that, relationship with them so that they can actually trust me because of what's been done to them previously by this person who called themselves X, but they weren't actually qualified in it. So feel free, absolutely 100%. Any therapist, you have the right. You absolutely, as a parent, you have the right to question our certification
and credentialing, right? Yeah. So at the end of the day, it's all about don't be penny wise, pound foolish. Just go for all the cheap stuff, and then later you wonder why it's not working. So again, it's about paying a price that you're comfortable with, but at the same time also getting that real value for money, if you may, because it is not just about the money, but it's also about the trauma you might, expose your child to if, let's say, again, the therapist is not, adequately trained, right, or qualified. So, okay, question 3C. How often will the appointments be for your child, of my child in this case? The parents asking, like the frequency, right?
Your child.
My child, a lot of children.
So this one's quite a difficult question to answer. It would vary from child to child. It depends on the child's needs. I have some children who would come 3 times a week. I have some who come once a week. I have some who come once every second week. Usually I would recommend that children would have more intensive therapy at the start, and then we can kind of fade it off. Because then if you have more intensive to begin with, then you'll start to see those good results that your parents want to see. And then once they're kind of making that progress, then you can get the parents to the parents should be trained at this point. This is part of what we do. So then they can carry forward as well. So then you can kind of reduce that therapy so they don't need to come 3 times a week. They only come like once a week or twice a week, and then kind of, reduce like that. And the parent, the parents are working with the child at home to follow through on whatever it is that you're doing in the clinic. The parents are doing at home, and so you continue to see those good results.
Lovely. So is it safe to say that there could be some protocols or some activities that parents can actually do to keep the child engaged, right, with the learnings?
Yes.
Okay.
That's why we like them in the session, is so that we can kind of, if we're doing an activity or something, like I'll usually be on the floor doing an activity, and then I'll just say to the parents, see how I just did that? And this is what you can do at home. Just, and usually it's something quite simple, like modifying their language, not asking questions, There can be very sort of simple tricks to getting your child to talk, but parents are just not, aware of it because they're not trained. So that's our job, is to train the parents.
So it's a dual role, right? It's like train the trainer. So you're training the parents, and at the same time, you're working with the child. And the best kind of learning is hands-on, right? So, like you observe and then you ask questions. So again, parents who want to get very much involved in your child's process, please, ask all the questions, get all the doubts out of your mind, and and it's valid, there's no such thing as a stupid question, because, sometimes we're afraid to ask those, right? Like, I don't embarrass myself, but no, because it is your child's welfare. You have the right to ask these questions, like, why are we doing it like this? Could we do it like that? How much of this should I be doing? And later, can I reduce this? Stuff like that. So ask these questions, and that's again the whole goal, right, of dialogues like this, is to talk about the practical day-to-day issues you would face, as a parent who's working with your child for ASD intervention. Right?
And if there's anything that we do that you're not comfortable with, then ask why we're doing it, and mention that you're not comfortable doing it. And if there's something that you can do another way, then we're open to suggestions, but we're also infallible. We're not infallible, sorry. So we're always open, and we don't ever want to do something that you're not comfortable doing yourself. So, it's like I said, we really have to work together. It's, symbiotic.
Symbiotic, That's a tongue twister there.
I know.
So there it is. Lovely. Okay, and the last question, ding, would be, are there extra costs associated with ASD therapy? Like, for example, buying supplies for continuing the therapy at home, parking fees, gas costs? Okay, very interesting angle. But I think it's more of like like how much do I need to allocate aside, for this whole
I
thing?
get it, yeah. So things, and that's a very good question actually, is because there's not one thing you think about. I guess it depends on where the centre would be located as to parking costs and, and if the centre is quite far from where you live. So obviously in KL and kind of surrounding areas, then there's a lot of centres. But when you go out kind of from that bubble, then there's few and far between. So a lot of people do travel from outside to come into KL, so then the petrol price would be higher. So I think most centres should have some sort of parking around them, but whether or not that's free, I'm not 100%. I can't 100% guarantee. And with COVID now, especially, then it's kind of a sort of, unfortunately, it's like sort of drop your kid and go because of we have to follow SOP. So that's a really good question, which I haven't really answered. Well, kind of, but
no, I think like you say, because there's so many variables here, so I don't think any of us has a giant calculator where you can key in attention to numbers, because it depends again, like what Stacey mentioned, on where you live, whether or not the route you're taking, goes through toll,
and
those
stuff. Kind of things.
So and also the parking rates.
It's hugely variable.
What about this one though, on supplies, for that center to continue?
So there are certain therapy techniques, therapy methods that we can use. One of the ones that I'm trained in is something called talk tools, which uses specific instruments to kind of work on jaw strength, tongue strength, lip strength, in order to get your child to help them to be able to have the power in their mouth and be able to form those shapes to make those correct sounds. So without trying to get too technical about it, so those ones, then they do require parents to purchase those tools. I do have my own sets and like sets plural. But of course with COVID, especially now, like restrictions, everything is obviously sterilized and everything, but we don't like to kind of have to share or anything. So then it depends on what the child needs, but sometimes, not always, I do recommend parents buy those.
On sets.
Unfortunately, I think most of them come from the US. You can sometimes buy them here, and if we can get them here that are not too expensive, then I would recommend place. But that's about the only thing personally that I would recommend. Parents often see me using certain toys or certain games with kids, and the kids seem to love it and they get good language from it. So then parents are like, where can I buy this? That's not necessarily a recommendation for me. That's just the parent knows that the child likes the toy, so then they want to buy it themselves. So there is that additional cost, I guess, but that's up to them.
So, but it's a range, right? So let's say, for example, the kit you mentioned, the one that helps them form the mouth shapes to make the right sounds. Roughly, how much would that cost? You mentioned it comes from the US, so
it depends on exactly what they need, but say probably around like 100 USD, which is fine. It's not that expensive, because that's what 300 ringgit, which is
about 300-400.
It's not super expensive, but then you factor in shipping. So what I try to do is, if I have a few parents who need some of these tools, or if I happen to want to do, a purchase myself, which I do, then to cut the shipping costs, to make it that cheaper, then I'll do bulk. You
can do bulk ordering as well. So I think the key takeaway also from this would be, get together into an ecosystem of parents, not just for the children, but other parents who also have ASD children as well, because then you can do bulk orders. You can even do, I wouldn't say really comparing notes, but more like, oh, my child's going through this. Did yours experience something similar? And if he or she did, what did you do to sort of help them get through it? Because then you're not alone, you see. And that's the whole idea about, again, Autism Awareness Month, because a lot of times parents sort of feel this dismay, it's like, okay, so I've got this, and I don't know what to do, and then they start to hyperventilate, and then they start to spiral. So the whole goal here is, no, you're not alone. There is a community here that can work with you, a trained, qualified community, and also that, if you can link up with other parents as well who are in a similar situation, and the empathy is there, right? And it's that group learning, So one of the things that we do at the Energy Source is we arrange like parent coffee mornings. Oh, nice.
And so this is like, like on a Saturday or Sunday morning, we'll have these kind of times where we'll invite parents to come, meet each other. So then you do have that nice community. And so they can meet other parents of, children who've got, who are on the spectrum as well. They can discuss with the therapist, they can all ask questions. And then you can see from there, you're not alone. I did the same thing when I worked in my previous employment in the special education school. And the same thing, and parents find it really, really, really helpful. And I find, especially with the school setting, then the parents have formed these really, really strong friendships, and they themselves go out and have like coffee mornings themselves after that. So, it's really nice. And I think it's really important because the stress, the burden on parents is a lot, especially mothers. And I feel like if you do have that community, then it's absolutely, it's just so helpful. It really, really is. I often have parents, especially mothers, who, they'll come to me, and sometimes, this is one of the things that makes, kind of a good therapist as well, is being able to give parents that time. So they'll come to me, and it's they're just genuinely upset about something, and so then you'll sit and just talk to them for half an hour, and sometimes that's all they need is just have a cup of tea and sit and talk about what's going on. And I've had parents have a little cry, and it's fine. It's fine. That's part of my job.
It's just a listening ear. Sometimes you're just so frustrated.
We're here to support parents and children. It's a family. We're there for the whole family. So.
Yeah, and it's especially true. Especially sometimes when you seek solace, in other people who do not have ASD children. And then it's like, I don't get what your point is or what your problem is. Why don't you just suck it up like normal parents do it and get on with your life? It doesn't work that way because your child has special needs. You see, and that's why I think sometimes when they go to their friends and who are not in a similar situation, they may not get that support that they need. And usually you just get brushed off sometimes. And you don't even get really good input that you could then take back and apply, right? So I think it's all about the ecosystem.
And I think parents, especially, again, I keep saying this, and I'm not dissing dads, I'm just saying mothers especially, because there's a lot of mother groups, or predominantly mothers in the groups. But they're the ones who sit and do all this research, and then they'll come to me and say, Stacey, I heard about this therapy, what do you think? And then obviously I'll have to check it out myself and see if it's evidence-based and all this. And so then, but then if a parent finds something that works and they come to me and it is evidence-based, then, and they do try it with their child, it works, it's helped, yay. And then they're happy to share it with another parent, and then the other parents have been having problems, and then this parent's told them this, and it kind of goes round, and then you can see sort of good results across the board. And it came from a parent, not a therapist,
Correct. So it's more like a testimonial.
Chain reaction,
That then brought about a positive change to the environment, actually, And that's why it's good to start up even your own localized groups, because we know that sometimes it's not feasible, like if you're in different states, for example, especially now with the MCO that we're having over here, where you can't do inter-district or you can, but it's interstate. You can't do interstate travel. So if let's say, one is in Penang and one is in Johor, and then you have this issue like you can't really meet because in different parts of the country. The whole goal is again to find someone in your locale, within your 10 km radius or so, that you can comfortably go, of course with proper SOPs and still have the support that you need. Yes. All right. Thank you so much, Stacey, for your sharing today. Thank you all of you as well for being a lovely audience, listening today. And again, if there's any questions, please write into us. We will connect with the energy source as well. And you could also go to their website if you have any inquiries to drop, especially when it's related to, maybe the packages or maybe some of the therapies that are being offered. So again, this is just our CSR project, of wanting to sort of create awareness about this topic, and you can, of course, we'll leave the contact details in the box below, and then, you can sort of get in touch with us. Yeah. So thank you so much.
Answer any follow-up questions.
Yes. So these are the ones that we've gotten, from the parents, but definitely I think after this session, we foresee a lot more might be coming. So maybe we could do a part 2. So let us know if you want a part 2, and we'll do it for you. All right. So till then, take care so much. Thank you for your time. Thank you, Stacey. And we'll see you all soon. Bye.